Thank you so much, Susan, for that introduction. And thank you to Zomedica for supporting this great conversation that we're going to have. I got to tell you, side note, Susan and myself, we literally just got on.
I got home today.
I know, right? You just got in. So it really has been a whirlwind, but it's so good to see so many of you that are maybe tuning in. Maybe you've been at Western, maybe you've been at VMX, and I just love this profession so much. And this is such a great talk, my friends, because this is what keeps veterinary medicine so fun and innovative. And we're going to talk about all the great technologies that we have had, both in our personal lives and also in our professional lives. So hopefully you'll see some things that probably will resonate with you back in the day. So as Susan mentioned, I am the Chief Veterinary Officer for DVM 360 and our conferences, which I certainly invite you to attend. We're going to be having our first one coming up next month of the year, March 24th through 26th in Charlotte. We'd love to see you there. Zomedica will also be there as well, so you get to see me present, as well as wonderful colleagues in there. So we'd love to have you there. I think it's fantastic. And we always just have to, can we just stop for a moment and just take a look at these beautiful pieces of Picasso artwork? Fun fact, by the way, that I just said Picasso. If you see my video here, over my shoulder, it may be hard to make out, but that is a Picasso drawing of a dachshund. And did you know that Picasso's first drawing was of a dachshund? He was a dachshund dad. I had no idea until one of my fellow doxaholics told me about that. So she gave me that picture. But say hello on the far left to Clark W. Griswold, our Queen Ween coming in with our dapple dachshund Chelsea. And then on the right there is Carl. And then on the far right is Connor. And yes, I'm that dog owner that has 4 C's. And I'm proud to announce that we are getting a 5th one. So be on the lookout for that one. We're going to be getting a standard wire hair dachshund. So go ahead and put congratulations in the chat, just so that way I know that you're around. I'm going to be utilizing the chat feature. So hopefully you'll be able to activate that so we can use that. So, but I do want to share that this is my why. And I know in vet med, and I say this around the country, always stay true to your why, so this is what I get up in the morning for every day, to help serve animals, my colleagues, and pet parents throughout the world through the social media space. So, all right, let's see if anybody can remember this. Comment down below. Does anybody know what this is? I'm going to give you a moment to see if you can utilize the chat box. I don't know if I can see it because my cursor is like, oh, wait, hold on. Let me see. Wait for it. Okay, I do see the chat box open. So does anybody know what that is? I mean, maybe I might be on the older side, but I'm sure, when we look at technology going through where we were to where we are and to where we're heading, it's pretty impressive. But this is a beeper. And so, if you were in high school and you were in middle school, all the cool kids were using the beeper. And that was like really cool technology from where we were with the telephone. You're like, oh, I got to go. I got, mom's calling. I got to be home for dinner. But remember where the beeper was and what that did and how that manifested and changed the evolution in which we communicated. I think particularly to our parents is really what it was, because I know back then. So, oh, it's disabled the chat. Okay, well, we'll get the technology to work. Maybe we can enable it. Maybe Susan, if you can enable a chat, maybe we'll see if that works.
It seems to be works. Okay, Emma, if you can fix that, that would be great. Emma's Control Tower 1.
Control Tower 1 coming to you hot.
That's right.
So, okay, so then we had the beeper, right? And then all of a sudden we had this wonderful thing called a flip phone. And we're like, wait a minute, how are we going to do this? And I remember mine, I had the biggest antenna possibly. I was talking and probably, giving people whiplash and shanking them with the antenna. And, we look at the technology from where that was. And I think when the cell phone came out, that kind of cell phone came out, I was just starting vet school. And I remember like, oh my gosh, this is so cool that I'll be able to heaven forbid, should I need it for my car or notify my friends or whatever. This is really cool that we had the cell phone, and being able to send brief little text messages or whatnot is even equally awesome. And so this was the evolution of the very first iPhone. And I find that that's so interesting too, because the fact that it was completely changed the way in which we communicate with our applications, and learning things about apps, and social media was starting to come into fruition. And, what did that make us do? Well, we learned we had to adapt and make some changes to the way in which we communicate, travel, do business, all those different things. And it actually made things better. I know there's sometimes because it made things worse, but do you remember when you had the TV actually didn't have a remote control? You had to actually go up to the TV and change the channel from usually 13 channels that you had at the time. And like, I was the son that had to do that too. And I loved doing it. It was like, Wheel of Fortune's on. Okay, change the channel, go this way. But now when we have like the cell phone, we're like, wow, this is pretty cool, you know? But if you were that kid and if somebody said, hey, you know, in about 15 to 20 years, you're going to be able to like send correspondence back and forth via a phone, whether it be an email or a text message, that's going to be pretty cool in the way in which, you know, humans interact with one another. Well, cut to where we are now. This is the latest model of the iPhone. I think it's the 15, I believe. I should know. I have that friggin' phone. I don't even know anymore, but I think that's like, it keeps changing. But, you know, it goes up to this incredible technologies that we have, where we have camera displays, video capabilities. I mean, really fast hardware that's in there for us to communicate better. And I really feel like, you know, nowadays, don't you get weird when your phone actually rings and you're like, oh my gosh, who has the audacity to call me? Like, haven't they heard of a text message, right? Or an email? But because our phones do so many different incredible things. And the reason why I share this story with you is because everything now is in our technology, is essentially in our hands. We live in a generation, in a time when we want answers right away. Either we want answers yesterday, and we're going to talk about what the newer generation is thinking of, because this is very, very crucial in how we practice veterinary medicine. And you and I know that we go into those exam rooms, whether you're practicing large animal, small, and whatever it is, these pet parents are looking up information, they're obtaining information. In fact, I welcome that kind of correspondence and that kind of communication. You know, they might be making purchasing, whether it be through you or through online pharmacies or whatnot. They're concerned. But my friends, I challenge you this. Look how far we've come now. I mean, we can actually use our cell phones to do ECG technology. We can also use it to do ultrasonography that I'm going to show you in a moment. But I mean, again, if I knew this 5 years ago that this was going to happen, I'm like, there's no way. How is this possible? But the way in which we can do these things is great, incredible, because it's a great tool on how we can better serve our clients. Now, let me see if I can show you a couple of these videos. And what this is courtesy of my good friend and our colleague, Dr. Fred Winninger, boarded neurologist. You know, two-way messaging apps, then video capabilities, virtual care, telehealth, artificial intelligence. This is currently the way we're practicing now. This isn't the future. This is today. This is what's happening today. And I'll tell you this, is that the newer graduates that are coming out of veterinary schools are asking their employers about this. Do you have flex scheduling? Do you have the ability to have virtual care appointments, telemedicine? And so I don't know if the chat's working, but I'm just going to see if you can just guess what's happening. Is that playing? It's hard to tell. Oh, the middle one's playing. Okay. So,
and not to interrupt, chat's disabled, but people can put their answers in the Q&A box and you'll be able to see them.
Oh, okay. Let me go to the Q&A box there. Okay, there we go. I see. Thank you very much. Got it. Okay, there we go. Okay. So, so what you see going on in the middle of that screen was a grand mal seizure. And what's important about this one is the fact that how many of our clients will tell us, you know, Dr. Smith, my pet is having a seizure. Well, is it syncope? Is it a seizure? Is it a focal? Is it a grand mal? Is it a post-ictal, pre-ictal? Send me some video, show me some video, because, you know, obviously there's a good chance that they're not going to be doing that in the exam room. So you want to be able to have that capability for them to see it. And look what we're doing now. We're enveloping video capability. And this may not necessarily be like a telehealth visit. This is somebody saying, listen, this cat just had the seizure last night and I recorded it. How about this one on the far left here? And so that's a very obviously a very, very common thing that we see in practice, and it's hard for pet owners to describe that a little bit, and so that's fly biting, or what we call like a mini seizure, focal seizures that could be happening. And so we know that there's underlying causes for those things. So for them to describe it, I'm always a huge fan of video capabilities. Do me a favor, if you can, take a video of it, take a picture of this, so that way we have an idea. And the one on the far right, let's see here, very similar to what you see with like the fainting goat syndrome, right? Very similar to, and dogs can have that issue. And again, the reason why is because these are tough things to describe, that for parents to describe. So they take video. So the ability to do that on your phone, send that to you, get an answer, or you could do this in real time, we'll have a virtual care consultation with them, I think is really darn powerful, because I don't think they have the ability to necessarily describe them as well as they probably could. Let's see if I can advance this slide. And then here's another one where we're seeing a dog that has an odd gait going on. And sometimes for us, and this is great for education purposes for our colleagues trying to neurolocalize lesions, that Dr. Winiger is so good for doing the gait, but that's a really great example, again, of video capability. For me as a general practitioner, if I had a hard time understanding what was going on with this dog, I would instantly, obviously, take a video, send it to a neurologist to help me maybe neurolocalize, and maybe give me some advice on what would be next steps. So again, the beauty behind technology that we have in veterinary medicine is pretty amazing. Virtual health and telehealth consults, all different generations are using some sort of a thing, whether it be through dermatology or a behavior consultation. I like the photo in the middle because I can't begin to tell you how many times you and I probably talk to our cat parents about litter boxes. We know that cats are extremely fastidious with their litter boxes, and pet parents, interesting thing, over the years, I'll tell you this, and this is why I love photos, I want them to take a picture of what they think is a clean litter box, number one. And so this owner sent me a picture of what she thought was a clean litter box and what she thought was a quiet space. What do you think is going on in that room, right? That's a washer and dryer that's in the room. And this cat was presenting for consistent, inappropriate urination outside of the box, obviously doing poop okay, but number one was a big problem. And so this is an issue. And she had 3 cats. So there's a whole litter box conversation. But still, I like that she did take a picture, because there's a lot of things that we can talk about with that room right there that could rule out some of the behavioral things before we go into maybe some medical components as well. So photos, virtual care. If you're not doing it, I would highly recommend that you somehow look into how you can implement that into practice. Okay. And I'd be more than happy to chat with you offline about, what does that look like pricing for you and your clients? And then how about this? We talk a lot about ultrasound, and, again, when you and I first started practicing, when we think of ultrasound, we think of like the big normal probe that we get and so forth. Now, we have things, I call it like the whole great, POCUS thing, point of care ultrasound. And, when we talk about access to care in desert hospitals, not everyone has the ability, depending on where you live, to go to a specialty hospital. So what I've been liking that Susan and myself and our colleagues at live events are recognizing is that we're really, really learning how to do certain things to really help keep our animals without having to refer as most as we can, like for an ultrasound, for instance, the radiologists are not expecting us to do like the full cardiac ultrasounds, but myself as a general practitioner, I should be able to identify basic effusions so I can make a better understanding and prognosis of what we can do to better serve our clients in an area where maybe there's not accessibility for them. And this is a great example of that too, where, these scans are not very, very expensive. You could do it in the exam room, and it could be, my recommendation for you is to do them on all of them. Do them while you have like your spays and neuters, do them on wellness visits. So that way you could just get used to seeing Doppler flow technology and what some of the, different hues and colors look like to you. So that way you can get used to it, and you can educate your staff too. And then, like CT and MRI, like how cool is this with where we're at? And even I think of like the hyperbaric oxygen chambers that are out there. We talk about things for pain management and snake bite, infections and so forth. But so, CT, MRI has come a very, very long way. And you're probably like, Adam, where are you going with this? But it's all about the technology, because if you take a step back And if someone said to you that you are no longer going to need your stethoscope ever again, they'd be like, what are you talking about? I can't live without my stethoscope, right? So when the creation of the stethoscope came into fruition many, many years ago, it was actually known that it wasn't going to be worth anything. Nobody's going to do this, they said. Nobody's going to use a stethoscope. But when we go into the exam rooms, you guys know, don't you feel, you do this, you feel naked when you don't have it on, right around your neck or in your pocket. You're like, oh my gosh, hold on, Mr. and Mrs. Smith or whoever, like, I'll be right back. Let me just go ahead and grab my stethoscope, because it's the like quincentennial part, or the quintessential, whatever. It's super important to have. And look how it evolved. Now we're able to do, the esophageal stethoscopes, the esophageal ECGs. You can also do EKG technology through the stethoscope now. And again, the evolution of that. And I guarantee that almost all of you in this room right now probably say, I don't know if we could do that. I don't know if it's possible. You know why? Because innovation can sometimes be a little scary. So what do you think of when somebody talks to you, and this is more specifically when we're talking about veterinary medicine, when you hear innovation? And when I go around the country and I talk about new things and new products, because it excites me, I love it. But I will tell you that most of us veterinarians tend to be, it's unbearable, because we're so busy, and it's just one added thing, one added stressor that we have in our day-to-day lives that we have to do every day, and trying to figure out, 1, the technology, 2, the price, and 3, the implementation of something just seems a little bit unbearable at this time. But I'll tell you this, my friends, it's not. Sometimes you have to take pause on what you're doing for the greater good, or the long term, or what you could do to better serve your clients and to your pets, of course. So it should be an exciting feeling. It should be like, okay, we can do this. And the best way, and I hope you write this down, the best way that you can get innovation into your hospital is through team buy-in. And when I talk about team buy-in, I'm not just talking about your internal team. I like to refer my clients as part of the team as well. So if you have a new type of service that you're going to be bringing in, what are your thoughts about us implementing shockwave therapy? Comment down below in the chat, or make a post of it on social media. Poll your audience and see if they're interested in it. Ask your team at staff meetings, we're thinking about changing a heartworm prevention to this. What are your thoughts, right? And they're gonna be like, oh my gosh, there's no way. But do you remember back in the day, does anybody know this one? Some of the newer vets probably have never heard or seen this before, but part of my job when I was a kid, I had a beagle growing up, and his name was Archie, and that's all it took for me to become a veterinarian. And it was my job to be on heartworm duty. And Archie, and at the time it was only liquid, not chewable, he would get his daily, that's right, daily heartworm prevention in with his food. So, right? So just stop for a moment and think about where we have come from daily filaribits to every 12 weeks, once a month. That includes heartworm, flea, and tick prevention in it. Like, you've cats to be kidding me. This is absolutely awesome. We have all these different things now. That's more of a compliance with safety, efficacy, and data that's there. And think about do you remember where you were when you had to change your heartworm prevention, whatever it was, or flea and tick? Because it can be challenging. And to get all your doctors aligned, I'll put pause in, because I know I worked in a 10-doctor practice, and for us to have a doctor's meeting about, like, all right, we have to consolidate which types of prevention we're going to align with and why, it can be challenging. But when you have something like that, you're like, oh my gosh. I want to stop here for a second and just take pause on the great ways of innovation and how it happens. And I want to emphasize this for a reason, because when you have your team meetings, this is a great, if you want to get a screenshot of this or whatnot, go for it. Because when you talk about practice management, how you're going to implement a new service, for instance, of remote technology, in this instance, we'll chat about as an example, how do we do it? And we start with the innovation wheel. And this is something that I've learned when I took my MBA classes. And this is your classic understanding the 10 ways. And it's divided into 3 components: experience, configuration, and offering. We're innovating something because we want to add value and advance something, right? Think about anything that's out there for innovation. And so on the left, we think of service. We want to support and enhance find things that's going to enhance the surroundings of your offerings. So let's just say, for example, maybe it's either laser therapy, maybe it's a new type of way that we're going to be treating wound management, maybe it's a way we're going to monitor patients. So, that's a way we're going to enhance service. And when I say the word service, this isn't necessarily like a product, although there are product performances that you'll see on the wheel, but necessarily like a service. So say, for example, we're going to offer house call services. Well, that's innovative within your practice in and of itself. And so you go through the innovation wheel as your team trying to figure out how we can implement house call services, because you want to be profitable, you want to do great client service at the same time. So then you're going to move on to your channel, how your offerings are delivered to customers and users. How are you going to go ahead and do this? Is it going to be, if it's you're going to be doing house call services, are we going to be going once a week? Are we going to just do it on appointment only? What is that going to look like? And what types of offerings are we going to provide? Is it going to be only end of life care? Is it going to be wellness? Whatever that is. And the brand is representation of your offerings and business. This is very important because how you differentiate yourself from other practices in your area and in your community is so, so crucial. And if you take on a new innovation, I'll tell you this, because we're going to talk about the new pet parent in a second, people will gravitate to you because you have something that's going to align with your brand, and the same mission, vision, and values are going to align with those pet parents out there as well. And how do we keep them customers engaged? This is all about, my favorite E word in veterinary medicine is experience. We want to deliver and meet and exceed a client's experience and expectations. So what are some distinctive interactions that you can foster? We know about practice management. A good example, for example, that we do is we'll put like the pets names on a dry erase board when they walk in to the waiting room or the service area when they're checking out. So that way they already know we're expecting them. And it just feels good. It's good when if you go to your dentist's office, they see your name on there, whatever it is. That's nice. Then you move on to configuration. This is where we get stuck. This is where most veterinarians also get stuck, is the how. How the heck are we going to be able to do this? What are the margins in terms of profit model? How are we going to build our network? And this is a really big thing in vet med, because you're going to want to market this through your social media, your website, and then also get your team to buy in, like I previously stated. Super, super crucial for this. And then structure. My best advice for anything that you're going to do in your innovation wheel is to make an SOP, some sort of a protocol where everybody is aligned. Because listen, there is nothing worse than you go into an exam room, making a recommendation, you shut the exam room door, you know where I'm going with this, and the pet parent goes to technician and assistant and says, do I really need what Dr. Christman just recommended? And you hear the technician go, no. You're like, wah, wah, wah. Epic fail, because the mission, vision, and values are not aligned and your structure is broken. So we got to figure out how we can create a good structure and a good process. Process is everything. You want to make sure your clients go out the door with a good experience, process is all aligned, and that you have a great product that's going to perform consistently to your offerings. So, whatever this may look like. And again, we're going to be talking about VetGuardian in a moment. And I do think it's a great example of all these 10 components of understanding the innovation wheel, because I'll tell you, again, the reason why I'm prefacing this before I talk about something is you're all going to say, how much, how are we going to do this? I don't know that this works for me, all those different things. So you try to anticipate all these different things. And I'm not going to lie, it's not easy. It's a process too. It's going to take time. It's not going to happen overnight, but these are some things but the bottom line is it's not impossible. So Dr. Fred Winninger too, he does have a 3D printing modeling company. And I just think this is so cool that he does this. So like he just was using an example of like what he does with artwork and a sculpture, and then he can take it and to build it to so many different things. I mean, talk about innovation in and of itself. It's unbelievable what the amount of work that can be done with just 3D technology, what they see both on the human side and then also on the veterinary space. So you're looking at like valves and teeth, even they're going into the I forget what he was calling it. Dr. Fred helped me, but I was saying it wrong, but something with the, tissue and 3D printing type of a component. Skulls, he gives many examples. If you haven't sat in one of his talks about this, you really should, because it's really fascinating about the advantages of veterinary medicine, because the good side to this is that it's not very expensive, and so it's great alternatives. And we have different species sizes. Think of the skull, like a pug skull, Frenchie skull versus a dachshund or a Great Dane, different. So utilizing 3D technology will help us with like fracture repair, brain tumors, all those different things that you could see associated with anything, spine, the list goes on. So I just think that's great. So look at this. Poor baby, right? This is a typical ICU room, and when I go into these ICU hospitals, they're hooked up to, as many leads, pumps are going, all these different things. And what we try to do is we obviously want to make sure we decrease fear, anxiety, and stress, make sure we're checking on them using data that's accurate. And we're going to talk about the importance of all these different things, because when you and I go to the hospital, how annoying is it? Just as like if you're hospitalized, heaven forbid if you were, every 15 minutes, they'll check you and do your blood pressure, and just as you're falling asleep. That's stressful. That's annoying. That's not how you heal. So it's come a long way. They're doing it in human medicine too. So I'll show you what they're doing on the veterinary space. But let's take a little look into the current pet parent situation. Now, as many of you know, the landscape of our pet parents has dynamically and shifted, which is great. Things happen. So, on the x-axis, we have our millennials, our Generation X, our baby boomers, and our builders. And on the y-axis is the percentage of the U.S. share of pet owners. Now, this is a staggering number, believe it or not. In fact, it's actually gone higher as of 2023 so far, because Zillennials is the Gen Z, which is right after the millennials. It's actually higher than the millennials. So it's actually, I think, almost 37% is where it's at right now. So very, very fascinating. And why do you think that's important? Well, similar to how you and I work, I know many of us work with Gen Z and millennial veterinarians and builders and baby boomer veterinarians. And so it's different when you're working with them as colleagues. But then also the landscape of our pet parents is different. Not saying there's anything bad or good over it. It's just different. It's so important to understand what your cross-section is looking like. And I'll give you an example too. The practice that I was at before I came over here to DVM 360, we had a very heavy baby boomer and builder clientele. And so that was so important for us to identify, because I know that not many are going to be as, and we asked and polled the audience too. We asked our clients about this too. They preferred emails, they preferred written reminders versus text messages, right? So I'm sure in a different landscape, that might be different for your clientele. Perfectly fine. So I always think that's so good to just kind of ask your audience and your clients, like, what works for you? And the best one to do are reminders, because that kind of gives you an idea of like what you're looking at. People either need to physically have things versus some clients that maybe want both, or maybe just want like an email alert or text message alert when they're overdue for a reminder or when they're due for something. So that kind of gives you an idea of like cross section. So the Gen Z pet parents, get a load of this. 81% celebrate their pet's birthday. 43% dress up their pets. 46% say their pets make them feel safe. 83% embrace wearables, virtual care, and technology for pets. I'm going to stop right here for a moment, because I really want you to absorb those numbers. This is very, very important and powerful. Think about this. So our Gen Z pet parents, this is across the world, 83% are embracing wearables. If you told me about 10 years ago, I don't think I was using the word pet parent. I don't think I was saying fur baby, fur kids, gotcha days, birthday paw teas, all my puns that I'm using and known for. Because the dynamic has shifted. And I say this wholeheartedly, my friends, it's such a great time to be a veterinarian, because, these clients are not just clients. They're going to be your cheerleaders. They're part of the community. They're part of the treatment plan. They want to do things actively. And so when you see that number, especially that bottom number, 83% embrace wearables, wow. That's telling me that our clients, our pet parents, want to really do what they can to learn about data for the greater good, to extend the longevity and improve the human-animal bond as best they can. They want virtual care and technology. So what does that mean? We need to go where our clients are. Okay, we need to go where our clients are. So the value of the pet care, let me just see my slide thing, veterinary care and boarding. Look at the price. Look at the amount of money that is coming in from veterinary care. From this is 2015 to where it's expected in just a couple of years, my friends, to 2025, from 16.3 to 25 billion with a B as in boy, $25 billion. And then pet grooming and boarding is getting huge. And, you know, just a side note, when I see this, this is another great conversation piece that I talk to my clients about when we talk about like vaccinations, for instance, especially like Bordetella, and over by us, we have outside of Philadelphia, have a little bit of a canine influenza issue going on. And so when you think of boarding and grooming, doggy daycare, it's just another good reason that I'll say to my dog parents why we need to be vaccinating against them, because of what we're seeing with this. And it's great that, you know, we're grooming more, we're boarding more, and all those different things. But again, we just want to be more proactive than reactive when it comes to certain infectious diseases. But then also, this also gives us some visibility, knowing that our pet parents are really willing to spend and do what they can to improve the lives of their animals. So this looks familiar, as we know. You know, we talked about you know, learning about virtual care. Interestingly enough, our clients are more into virtual and telemedicine and technology than some of us are in general practitioner world are. So, you know, what do? So Wearables, for instance, is a really good example why I did title this as from Wearables to Unbearables, because the Wearables is really B2C, so very client-facing technology. And the gap that happens is some of us veterinary professionals realize, we don't know if we really need that or not. But I'm going to tell you something. We do. It's great to work with the pet parents when they have this types of technology. Now, I just did a Google search that you see right there in front of you, and I just wrote the word pet wearables, and look how many, and look at the cost difference. And it's just can be overwhelming for you. And so you're like, well, some of it has GPS tracking technology, some measures, monitors behavioral changes such as shaking, trembling, biting, and some changes and whatnot is important because that can marry with your treatment plan. So for example, if you have a dog that's on Apoquel or Cytopoint, maybe Apoquel is a better example because sometimes you don't know when if they're doing BID dosing or they're on once a day dosing with Apoquel, but then they get an alert in the middle of the night that they're scratch, shaking, that their dog's shaking a lot from the itchies. Maybe you can change the frequency in the dosing of when you're giving Apoquel. As just an example. Same can go for like seizure medications or whatnot. So you get this information that could be really, really powerful stuff. So please don't dismiss it, because your clients will be really upset because, you know, nothing irks pet parents more. I can tell you this because I do live streams with them all around the world every night on TikTok. And some of them say, like, my veterinarian just dismisses me a lot when I talk about technology or when I talk about like food recommendations or whatnot. So we have to really elicit the dog parent's perspective. Another little fun fact, if you don't know Dr. Ryan Engler from University of Arizona's College of Veterinary Medicine, I highly got to give her a shout out. She has great lectures and great communication sound bites on eliciting the dog parent's perspective, cat parent's perspective, and the breeder's perspective. And it really has changed my mindset and the way of practicing veterinary medicine. And I think it's something that I invite you all to listen and check out. So pet parents genuinely want to keep their pets healthy. Look at the number one concern: safety. And medical diagnosis is right underneath there. So we don't want our dogs to like run out. That's where like safety comes in, GPS, microchipping, and then keeping them free from anything such as like toxins. That's a big thing. So they're always looking up those kinds of things. Medical diagnosis. So if a dog's diabetic, what are some things that they can do to help manage that? Same for cats. Monitoring, treatment, tracking, security, well-being, and gathering health data. You know, we live in a world now where, you know, we're worried about our own health. We want to exercise, but I want to know how many calories did my dog burn at the same time when I'm running with my dog? Or, you know, how do I know if it's too much? Or, you know, what about like their temperature? Like, I mean, I'm so glad nowadays we don't have to take their rectal temperature anymore. We can use like the mellothermometers now, and we'll soon see one that we can use in hospital. So the US pet wearable technology has really gone up. And now this is a combination of RFID technology. Similar if you've been to Disney World and you use the magic bands, that's RFID technology there, the GPS system, and then sensors in general. And so as you can see, it kind of did a real rapid increase. And again, by 2030, it's going to be certainly being a big player in the veterinary space for pets. So especially GPS technology, which I think is great. You know, I always say this, that You think of like your home again, microchip is like your social security number. So it's absolutely essential to have that. And then of course, like having some sort of a GPS sensor or whatever it is another good one to have. And this is another great example of what pet owners are looking at. Almost $700 million globally since 2021, it's gone up since then, is spent on this type of technology as pet wearables. So it's not going away, my friends. It's not going away. It's staying here. And identification tracking is up top of mind. But interestingly enough, look at medical diagnosis and treatment. A good piece of that pie is medical diagnosis and treatment, as well as facilitation and safety and security, as well as behavior monitoring and control. Now, I'm not saying this is making any diagnosis, but I think this is a great tool to use in conjunction with your physical exam, your conversations with the pet parents. It's really fascinating. So I'm going to take a break here. I'm going to ask, how many pet wearable companies do you think there are as of December 2022? So just a few months ago. See if you can put it in the chat box, and I'll see, or the Q&A box, and see if you now take a wild guess. Do you think it's like 20? Do you think it's 50? Like, how many do you think are out there in this space? Because I did a Google search, and again, just from that page alone, you'd be surprised at what you see. And so the answer, my friends, is 284. Hold on, 284. What? That's a lot. It's a lot of wearables, And so my suggestion when I hear this number is there's can be a little bit of noise that's there. We're scientists, so there are some really great ones that are out there that have great science and data behind them. My suggestion, if you haven't done it this year, this is a good one to do, is align with your hospital and choose 3 or 4 wearable ones that just are good for your practice. Which ones would you recommend? Not saying you have to carry them, but when you have clients that are asking and showing you with their phone in your, in your exam room, just like we previously chatted about, give them some recommendations, guide them along the way. Okay, so important to make guidance recommendations. They're paying for your expertise, for your recommendations, and then give them a little bit of a why. Why are those the ones that you're recommending? So, why does this all matter? Well, pet owners are aware of the technology. Pet owners are confident in technology, hence their purchasing power, as you can tell. And pet owners expect their veterinarian to be current on the latest technology in veterinary medicine. They expect it. And if you don't have it, they're going to go to a practice that does, because they are doing their research and finding out. If they go into a dilapidated or antiquated veterinary practice, chances are, especially for those Gen Zs and millennials, there maybe not be good alignment. I mean, again, don't get me wrong, there's phenomenal staff and people that make the magic happen, but they want to make sure that you're up to date and current, at least on the way that you can diagnose, treat, and manage their animals. And so the veterinary hospital landscape is a little bit different. We previously chatted about heartworm prevention, and we know what a changer that was tough. I remember, are you ready for this one too? Do you guys remember Slentrol? Did anybody remember this? Or anyone use Slentrol when this came out? This was at the time Pfizer before it was Zoetis, and this was an appetite suppressant for the treatment of canine obesity. And I embraced this sucker like I was giving them out like hotcakes, because I really thought it was fantastic for weight management. I embraced it. We had over 300 dogs that were on it, but over time they would yo-yo back to it. But what made me in this practice create something like this? Well, listen, there wasn't a lot of things out there to treat canine obesity. The science and the data was great. People bought into it. The team bought into it, and it worked really great when it did. But I use it as an example because technology, innovation, yes, please, let's try something and see what we can do. So I want to chat with you about workflow, because workflow problems, boy, they're tough. I think they got a little bit better as we're trying to, not as curbside-ish, because that could be a little bit of a hassle too. I know some of you may challenge me on that you prefer curbside, and I certainly understand and recognize that. But speaking of our wonderful and incredible support team, I mean, it's tough, trying to, have the technicians and receptionists balancing wearing all these different hats that we want them to do in surgery, as well as taking the vitals. And some of those things, such as vitals, for instance, it can be time consuming. It really can. And, it's come a long way nowadays where we want to, in an effort to kind of minimize our technicians from getting bitten. I can't begin to tell you how many of my students, because I taught the veterinary assistant program for a while. And so like, just trying to teach them and identify behaviors before you open up the cage. That's scary. Side note, tell me, that this has happened to you is when that cage door is open above her head and you go in to take the heart rate, respiratory rate, and you don't realize that the door is open. I don't think there's anything more painful when you hit your head or your back on those cage doors. Was I the only one? Oh, Kelly Clarkson really hurt, man. Anyway, so, but the reason why I'm giving you these examples, there's so many things that can happen that you just take for granted, so, but vitals are super, super crucial. Patient stress team, look at all the pumps that are going off. And we want to improve efficiency and utilize our technicians as best as we can, and create some differentiation. When I think of like, when you provide a client treatment plan for, let's just say dental cleaning, for instance, and you kind of go through the itemization of what that looks like. And this could be anywhere from the anesthesia to the dental cleaning to the patient monitoring and recovering fee to hospitalization. Interestingly enough, I don't know about you, but I always got asked about patient monitoring and recovery. They're like, what do you mean I have to pay X amount of dollars for patient monitoring and recovery? Meanwhile, like if you and I have a procedure, you're paying a lot of money to have somebody doing your vitals, taking care of your TPRs and monitoring you while you're under anesthesia. But pet parents certainly would ask that question. So, I was like, well, how do we try to add value to that? And how do we do something in a way that is innovative and cool and has accuracy and precision while we can let our wonderful fur babies try to rest comfortably without disturbing them too much? And I do think VetGuardian is a great example of this. Now, this may look like an EKG machine to you, but this is actually called VetGuardian. It is by Zomedica. And I think it's actually pretty darn fascinating technology. That video that you see on the right, that's actually a live video feed that you're seeing. So let's just say you happen to be in the treatment room, you might be upstairs, right, doing callbacks or whatnot. You can have that live video feed anywhere that has Wi-Fi, Bluetooth technology. So you could even be home if you happen to be, because you know how us crazy veterinary professionals are. We always like to check in on our patients, but set boundaries, obviously. But the point is that you can actually see what they're looking like, making sure they're comfortable. This is something that can actually do heart and respiratory rate without moving the animal. And it can also do thermal temperature as well. So it's based on continuous waveform Doppler radar technology from the external carotid artery of dogs and cats. So micro movements of the carotid artery and the lungs, and it's converted into pulse and respiration. Now, this is something that can be mounted on a cage, or you can actually, kind of move this on kind of like an ECG stand or whatever along your cages and go down if you want to do it that way as well. So core temperature, pulse, respiration, and movement. And so this could be, like I said, on your laptop. It can implement with your practice management software system. There is a great YouTube video that's there if you wanted to learn more about it. But, core temperature, you think of like a company like Digitherm, for instance, or if you're doing some practices will use it when they go in the exam room to look at pain, inflammation, redness. And so that's detected by thermal camera and proprietary algorithms that are there. So it lets you know, if they're running too hot, too cold, and it can let you know certain areas of redness or inflammation. So just to kind of take a screenshot further and show you, like, you have the heart rate, respiratory rate, and temperature, and you could set the parameters in order for this to ding with an alarm system that you see there. So whatever works for you, it can alert the client, the team, excuse me, not the client, the team or the professional that's on that duty. So I think that's really cool. And I do love that it has a live video streaming that's there. And, another great thing is that you can add notes to this as well. So you could put in, and that's in French, you're not losing your mind. But if you wanted to know what was done, for instance, added more that like post-op hemilaminectomy, at the times you can timestamp it. And what I also like about it is that it also can go into the patient's medical record and it can give you the vital data that you see. I think this is great because should you have clients that are transferring from the ER, or if you're working as a referral hospital, for instance, this really gives you a good play-by-play about what's going on. And I know that you can, we know about pain recognition when they're uncomfortable, and alerts can be set off. And then you go ahead and say you give them methadone, and then you notice that the heart rate or respiratory rates are stabilizing a little bit more because they're maybe not as in pain. These are great things that you can do for your practice. And again, I'll tell you this, I know clients are, not all, but some clients like Gen Zs would really be all over this, knowing that like you have that information. Some may even want it, but when they see this as your patient monitoring recovery, now this is the magic moment right here, is when you show a patient journey, and hopefully you do, but you could get like a GoPro camera, you can even do it on your iPhone camera, but you show the journey of what that looks like for dental cleaning from start to finish. When you enter and you go, hi, my name is Dr. Adam Christman, so good to see you. I'll be your veterinarian today, along with my veterinary assistant and technician or anesthetist, blah, 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 blah. Here's what we're going to do to monitor and recover you. We're going to be using the VetGuardian here. That's going to keep your fur baby as calm as possible without us poking them. Trust me, it's accurate, it's precise. We're all going to be alerted if anything was to go wrong. We're going to be sending you home with some dental treats and some follow-up care, blah, blah, blah. I think that looks really great, because what that's going to do, it's going to help minimize your anxiety of going over treatment plans. And I think it's also great that you show added value to something such as patient monitoring and recovering. So better patient care, added value to the hospital. You know, I put in patient monitoring and recovering fee. I don't know about you. Sometimes some of you will envelope that into your surgeries, perfectly fine. But I always like to leave that as a call out, because you and I know we have our pet parents that will, you know, go over itemized numbers. And this is a good example as a talking, kind of a good soundbite you could chat with. And then I do think it's an excellent social media campaign. And what do I mean by that? Again, we live in a time where we want to show everybody what we're doing, and especially anything that we could do to help minimize that stress. So here's an example. You could say something, I know I don't want to be disturbed when I'm recovering from my procedure, and we don't want your fur babies to as well. So this is something called VetGuardian. We're using this to help minimize fear, anxiety, and stress. It's going to monitor temperature, pulse, respiratory rate. And this way, we can even give you a copy of it, of the findings, and your baby is going to be rest assured, and they can't wait to come home to see you. Learn more, blah, 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 at ABC Animal Hospital. Schedule your visit today with us. So those are kind of like basic social media campaigns that you can do. Doesn't have to be a video. You could do a stagnant post. Those of you that know me know that I love me some social media, because I think it's so important to get their buy-in. We talked earlier so far this presentation about the importance of Gen Z, about connecting and building that sense of community with them. And this is a great example that you will get their buy-in if they see something like that on social media. So why is this so important? Now, in conclusions, we're wrapping up here. You know, clients are asking for it. We talk about better flex scheduling. And what I mean by that is the fact that, like, you know, with our technicians, it's a physically demanding job. My gosh, we all know we're all bending over our backs or knees. If we could do anything to have a little bit more flexibility where we can utilize our technicians and ourselves a little bit more into other areas of the hospital, I think that's a win. And I think this is a great tactic when you're looking at recruiting and hiring, so you can show them what their job description is going to look like, and that you have this great technology. I know I'd be all up on that. And you can monetize and improve workflow. Listen, my friends, we know about online competition, but one thing that we're really, really, really good at are services. So if there's anything that we could do to kind of capture and enhance our services that we do to have positive patient outcomes, I'm all in. And I think that's a great example of it. And I do love wearables and remote monitoring synergistically. I think, you know, you recommending 1 or 2 or 3 different types of wearables to your pet parents for their dogs and their cats really does show that you trust the technology, and you can utilize that when having a conversation in the physical exam. I know on the right that I did the diagram of virtual care. I know it's a slow climb, but I know on the human side, it's all there, as you and I know. I think COVID has rapidly set a match under all of us in terms of technology to go faster with what's being pumped out in the pipeline. And I can't wait to see what's going to be happening over the next couple of years, because some other newer stuff that's out there. But, you know, these are very, very basic things. So, you know, work from areas of the hospital to better improve workflow efficiencies. So I think that's really nice as well. I'm a really big fan of anything that we can kind of do to improve our quality of life and our own mental health is really a home run. And again, everybody, if you need your oxytocin moment, there they are again. It's Clark, Deborah, Griswold, Connor, Carl, and Chelsea with dachshund number 5 on the horizon. I can't wait. Oh my God. But I invite you to check out my website. It's my email address. If you have any questions, I do have the talk show. Season 2 is filming next week from DVM 360 Live. It's a great talk show where we get to showcase all of our wonderful colleagues, both in and out of the exam room. So we have veterinarians, vet techs, assistants, CSRs on, and we'll talk about them, all the great work they're doing as veterinarians, but then also maybe they're a chef, maybe they're a runner, all these different things. And I love that because it just shows holistically that we're great human beings for what we do. The Vet Blast podcast, if you're interested in being a guest on the show, hit me up. Love to have you and get to know you better. It's only a 25-minute podcast. Also, it's available everywhere we listen to your iTunes or your podcast. My Instagram. And then my tick to the talk is where the party is at. I'm almost at 1 million followers. I'm getting there, you guys, but it's a fun party. I love educating pet parents and colleagues and students. I think it's such a powerful tool utilizing social media for the better with what we do for veterinary medicine. I also want to thank Zomedica for supporting this session. And I do want to give them a big shout out because I'll tell you this, you guys, their portfolio, if you haven't checked it out, check out Zomedica's portfolio. They're just getting started, and having this type of technology, whether it be through clinical pathology for like hyperthyroidism or resting cortisol, CC loops, shockwave technology, the VetGuardian, this is all cool stuff, my friends. I mean, this is how we advance and grow the profession together for the greater good of the animals. And I think I wouldn't partner with anybody that is not doing anything like that. And they're doing great work. So I just want to give them a special shout out. And I want to thank you all for your time as well. So thank you for tuning in. And I think we have a couple of minutes for any questions.